Hi, so my name is Kaitlyn Baptista, and my project is called A Cross-National Study of Body Image, Exploring Differences in Media Exposure Across Jordanian and American Women. So body image is defined as the multifaceted psychological experience of embodiment. And pretty much what this is, it's the way you think about your body. It's the picture you imagine in your head, whether it be accurate or not. A negative body image is one of the strongest predictors of eating disorders such as anorexia or bulimia. A negative body image can also lead to poor self-esteem, and it can also lead to destructive exercising behaviors. Another factor that can affect body image is social factors such as information or comments you might get from your parent or peers, and you also might get some teasing, or you can model some of their behaviors. So what's important to realize is that body image dissatisfaction affects people of all ages. And most research mainly only concentrates on young females, but it's also prevalent in older females as well. And actually, Davidson, Wellborn, Thill, and Lash did a study where they realized that children as young as the age of 6 begin to prefer thin body types. And this might not lead to negative body image then at the age of 6, but as you get older and you're trying to maintain and obtain this body size, you might get some negative body image when you realize you can't, or it's harder than you thought. And especially as you get even older into midlife and elderly, it's even harder. And there's also a lot of eating disorders in the elderly that go unnoticed, but really it's really important at this time to recognize it because of the health implications. They're more at risk for osteoporosis, for stress factors, and for slower cognitive performance at that age than they would be at the lower age with eating disorders. So media exposure is something that I believe in, that research has shown to be have a powerful effect on body image. In the West, our media portrays the ideal body size with the thin ideal. Women are supposed to have an angular body shape, lean and toned. And Nidell talked about in her book, Understanding Arabs, how Arabs are really interested in our culture, in our media, our music and all that, and with the media, they're also kind of bringing in the thin ideal. And prior to this, and still kind of right now, non-Western cultures prefer a larger body size. So this is something new to them, and it's not really something that's positive for them to be taking from us. And research has also shown that at the same rates that non-Western cultures are modernizing and becoming a little bit more Western, the body image dissatisfaction and eating disorders are also rising at the same time. So the purpose of my study is to examine the effects of media exposure on body image across culture and across generation. So my first hypothesis is that Jordanian college women will have greater media exposure and as a result have more body image dissatisfaction than the older generations in Jordan. My second hypothesis, which is regarding culture, states that the American students will have greater body image dissatisfaction as a result of the greater media exposure that they have over the Jordanian students. So we collected our American sample here at Bridgewater State College, and our Jordanian samples were obtained from Yarmouk University in Arbid, Jordan. We obtained actually the college women there, and we also sent home a shortened survey with the college females to take home to their mothers. So that's why the mothers have a little bit of a smaller sample size right now, is because we had to, the response wasn't as high. So the measures that were included in my survey were the multidimensional body self-relations questionnaire, the appearance subscales, and the specific subscales that I'm using are appearance evaluation, which includes items such as my body is sexually appealing. Higher scores on this subscale indicate a higher body satisfaction. I'm also using the appearance orientation scale, which includes items such as before going out in public, I always notice how I look. So people who score higher on this subscale, they care a little bit more about their appearance, they put a little more time into getting ready. And the last subscale from this measure that I'm using is the overweight preoccupation subscale. This includes measures such as I constantly worry about being or becoming fat. So if you score higher on this, you have more anxiety about becoming overweight, you feel like you need to diet so that you don't become overweight and things like that. For media exposure, I'm measuring that using the sociocultural attitudes towards appearance questionnaire 3. The subscales from this measure that I'm using are internalization in general, which includes items such as I compare my body to the bodies of people who are on TV. So pretty much if you score higher on this scale, you're internalizing more of the ideas from the media. Pressures, which includes items such as I felt pressure from TV or magazines to diet. So if you score higher here, you feel more pressure from the media. And information. TV programs are an important source of information about fashion and being attractive. So if you score higher on this subscale, you think that the media is a valid source of information, and that's where you turn to see how you should look and dress and stuff like that. In addition to the social cultural attitudes towards appearance, I've also included some extra questions just to see exactly how many hours they were spent on being exposed to the media and in what types of media. So we asked them to record how many hours a week for television and magazine they were exposed to news and current events, health and fitness, fashion, entertainment and gossip, and sports activities. In this chart, you can just see the body mass index scores. You can see how these are all significant differences actually, except for the overweight preoccupation, and I'll get to that. The mothers had significantly greater body mass index than the students, and the Americans had a greater body mass index than the Jordanian students as well. American students scored highest on the appearance evaluation, but it was the Jordanian students who scored highest on appearance orientation and overweight preoccupation, even though it wasn't significant. And then for the media exposure measures, it was the American students who scored highest on the internalization and the pressures, but it was the Jordanian students who thought they got most information from the media. And this chart just shows for the television how many hours a week they recorded for each of the different categories. And surprisingly, the Jordanian students reported significantly higher time for each of the media subscales than the American students, except for on sports. The only thing that wasn't significant was the difference between the news for the mothers and the students. And you kind of see the same results in this chart, which is the magazine instead of television, except for this time the American students spent significantly more time reading about entertainment than the Jordanian students, and the Jordanian students read more about sports. This is just a correlation table. The bottom half, which is in red, represents the correlations for the Jordanian students, and the top in blue represents the Jordanian mothers. The mothers who internalized the media, which is number 5, and felt the most pressure from the media, which is number 6, report being more preoccupied with their weight and consider attractiveness to be important. And you can see this in these right here. The asterisks indicate significance. For the daughters, the ones with the higher BMI, which is right here, had higher body image dissatisfaction, you can see because it's a negative correlation for appearance evaluation, and they had less investment in their appearance, another negative correlation, and more preoccupation with their weight. Surprisingly though, if you look right here at appearance evaluation, down here with the media subscales, there was no significance. And now in this chart, Jordanian students are still on the bottom, but this time it's the American students on top. And if you look at how they scored, their scores correlated, for them the appearance evaluation, they were significantly correlated with the internalization in general and the pressures, but not the information from the media, which is the complete opposite of the Jordanians. So as we had expected, the younger generation of Jordanian women did report greater media exposure than their mothers. However, it was the older Jordanian women that reported more body dissatisfaction and spent less time on their appearance and how they looked. On the other hand, it was the American college women who reported less body media exposure, which was not what we expected, but they also reported more body image dissatisfaction. And what's interesting is that even though the Americans reported watching TV less, they reported more internalization from the media. So right here, it's not so much the quantity, but how it's affecting them. And they're definitely getting the more negative body image from the media, even though they're not exposed to it as much. And one of the reasons I think this might be is because the Jordanian women, they're just starting to be, exposed to this media that has been with us for a while. And it might also have to do something with the fact that we're looking at college women and they might not have as much time as they did when they were younger to watch more TV. But here in America, our society is all based on the thin ideal. So even if you're not watching TV, your mother might still be saying, hey, you should be a little bit thinner. Whereas in Jordan, they are experiencing some of this media exposure, but their society is saying you should be larger. So that may be protecting them from the body dissatisfaction that's affecting the American women. So some of the limitations of my project are that I didn't have an American mother sample yet. I will be trying to do that this next semester. The unequal sample sizes, I'm also going to try and gain more of the American student sample. And another thing is that I didn't really look at how the body mass index was affecting the body image at this time, so that might also be coming into play along with the media exposure. And of course, since this was a cross-cultural study, we had to get all of the scales translated into Arabic, and some things may have lost their meaning in translation. So for the future of my project, like I said, I'm going to try and get an American mother sample, a greater American sample in general, and hopefully I'll be able to use a multiple linear regression for a more in-depth analysis of my study. And I also was thinking about looking into eating disorders because it's really interesting how the Americans were affected on the appearance evaluation scale, but not the appearance orientation or overweight, but the Jordanians were.